We've had a lot of discussions in this meeting about patients with ALK-positive disease. We had an excellent symposium with my colleagues, Dr. Enriqueta Philippe, Dr. Garasino and Dr. Tony Mock, discussing the treatments of patients with ALK-positive disease. Really, ALK-positive disease has a propensity to go to the brain, and it's important that clinicians are aware of that. These metastases can often be cystic in nature when they're identified, so it's important to be aware of that. If patients are starting on first-line crizotinib or still benefiting from first-line crizotinib, there is a higher propensity of CNS metastases, so monitoring of these patients on crizotinib I think is really quite important. Other patients are on next-generation inhibitors and they're doing very well. And the next-generation inhibitors have got excellent intracranial activity, both in patients with established CNS metastases at presentation or those without CNS metastases at presentation, and seem, to the data that we have, to be neuroprotective. We have the most robust data so far for alectinib and brigatinib. We're waiting for more mature data with brigatinib. The question then arises as to what to give next to these patients, and currently lorlatinib has a license in that indication, and we see, depending on whether the patient is switching to lorlatinib from crizotinib or next generation inhibitor, very good activity intracranially and a bit more modest activity extracranially if they've been on a next generation inhibitor up front.